My name is Dr. Jeffrey Chen. We're about to see patient Mr. Manning for an implant crown. And we have assistant Gloria here helping us. But yeah, let's go ahead and get started. Okay, so Manning right now, he has a healing cap on so the tissues can heal around the implant. So what we're going to do is take off the healing abutment so we can actually attach a crown onto this implant here. All right, so we're gonna go ahead and take this healing abutment out. And all of this is very straightforward. We do not need to numb up the area because we're not doing anything very invasive here. All right, so the healing abutment is out. And now we are going to place the crown abutment on. Okay, so now we have to take a x-ray. And the type of x-ray that we're using is digital x-rays. It's different from the film x-rays that were used many years ago. But the digital x-rays, they emit less radiation, and with the digital sensors, it takes less radiation to capture the image. And afterwards, we are actually able to adjust the brightness and contrast to see what we need to see. That's good, that's good. Yeah, perfect. So right now, we're going to pick a shade that matches your existing teeth. This way, when we restore it, it's gonna blend right in. All right, so we have this Vita shade guide and just a wide array of shades that we choose. This is where it takes some practice to know what shade is going to match the existing teeth. So we're going to be with A2. This is a resin, and it is light cured. After we place the light on it, it sets, so it makes it hard. And we're just getting the curing light here. All right, and this is a contrasting spray. So when we take the digital impression, there's no reflection of saliva or any part of the tooth. Just a lot of powder. So this is our CEREC machine. We can actually design and mill a crown the same day. And normally, with crowns, you have to take an impression with the putty mold, wait about 2 weeks for the lab to make the crown, and you would go home with a temporary crown. Nowadays, we have the CEREC, we can actually make the crown the same day. Instead of the putty, we take digital impressions, like what you see here. With those impressions that we just took, those digital pictures, the computer modified it so it can get a three-dimensional image. And we're able to work off that three-dimensional image to form a crown. And that's how your jaw comes together, right here. And this space is the space that we're going to restore it with a crown. So right now, what the computer is going to do is pretty much make a crown. And it uses the space that we have, it uses the adjacent teeth, and it just calculates what the best fit crown is in this situation. The blue marks are telling me the areas that you're biting on your opposing tooth. So I'm adjusting it so that when you're biting down, the bite feels even and you're not biting on like a pebble or whatnot. All right, so it sends this digital file to the milling machine, and we'll show you in just a second the milling machine. All right, so we're gonna transition over here. So the next part of the procedure is after this milling is done, we take the crown out, we polish it, clean it, try it on, make sure the patient likes it, of course, make sure the bite is right, make sure the contacts are good, and after that, we just cement it in and glue it in. All right, so the milling unit is finished milling this crown, and what we do is just basically snap it right off, and it comes off, and I just have to make some adjustments, polish it, clean it, and try it in the mouth. Make sure the patient likes it, and after that we glue it on. Restoring smiles is what I like to do. I'm a person that likes to smile myself, so if I can give that to the patient, that's even better. Okay, right here, this is the tooth that we worked on. Underneath is an implant, and designed it and milled it the same day, and we're about ready to cement it. And what we're doing is shining a light on it so that we cure the cement so it hardens and it sets. All right, so we got to rinse, clean up any excess cement, and take an x-ray to verify everything. And we are all done, sir. You did great. Yeah, I couldn't have done it without you. Okay, all right, you're welcome. All right, bye-bye.
Thank you so much.